You should allow yourself 6 months to finish a case. Each month you study the beginning models and the current results to make sure you have attained a full correction and that you have attained the best occlusion and aesthetic arrangement possible. During this entire time period, we use the same wire to avoid errors in remaking wires. Let's now follow the process of a finishing case on video. On our first case, the staff member has already removed all the ligature ties and elastics except for one. The doctor then, when he comes into the operatory, will remove the last ligature and determine what needs to be done for that particular case. Here, we will note that the incisal embrasure between the upper right lateral incisor and the upper right central would require that the upper right lateral would have the root tipped to the distal. That would reduce the incisal embrasure. As well, we would like to intrude the two central incisors, probably about a ½ millimeter. We will compare them to the starting models and make sure that the aesthetics of this case are what is desired. Now we will mark the wire with a wax marking pencil. This will be the place of our bends. In this particular wire, we will already have had some bends in place. We need to ignore those bends and merely make the adjustments that you see are appropriate. On the lateral incisor, we do have a choice when we tip the root to the distal to move the mesial incisal corner down or up, or leave it where it is. In this particular case, we would like to leave the mesial incisal corner of the lateral incisor at the same level. This would require making a bend that is a step up in the cuspid area. But the second order bends are very difficult to visualize. So let's first start by making the step up on the two central incisors. Once in a while you will lose track which mark is which. So you may just merely replace the wire so that you can visualize it. This is the step up on the one central, and on the other central we will step back down. Most of these bends are going to be small bends, about 1/2 millimeter in size. For the novice, he will generally make the bends too large, making it so that he cannot replace the wire back into the brackets without causing undue pain or knocking the brackets off. Now we're making the lateral bend. You can see the distal root tip on the lateral incisor. Now check your arch form. And then the doctor should replace the wire. This will avoid turning the wire upside down. You can see the step up on the central incisors relative to the bracket slots. You should be able to easily engage the wire into the slots by finger pressure. Now let's go to the lower wire. We have determined by looking at the starting model that the main place of relapse would be on the lower right lateral incisor and the lower left cuspid. Let's now view where the teeth are at this point. If you look at the cuspid has in fact been overcorrected. The mesial of the cuspid used to be rotated labially. But on the lateral incisor, relative to the cuspid, it is still inset. This is where it started on the original model. This is an undercorrection. You would not be able to visualize this in the mouth without comparing the starting models. We will do this for each case in our finishing procedures to be sure we have a full correction before debanding. In this wire, we already have a step mesial to the cuspid. What we need to do is to de-accentuate that step, making it smaller, which I just did for you. De-accentuation is done by reducing the angle of the step between the two planes of wire. You should now have to place a ligature wire on the lateral incisor in order to gain wire engagement. At this point, we will tack down each wire with one elastic ligature tie. And then we will use any steel ligature wires that the doctor feels is important to gain the bracket engagement. These will be placed lightly, and the staff member will do the finished tie-in and tightening of these ligature wires. Our staff member is now ready to take over. This case, on completion, had a nice aesthetic result with a nice incisor arrangement and an equally nice Class 1 occlusion on the right and left. She was quite pretty, especially with her new smile, and her profile was very pleasing.